Welcome to the Longevity Protocol with Dr. Cristina Bosch and Dr. John A. Robinson. We'll be your guides to uncovering the secrets to optimal health, better sex, and happiness. From debunking aging myths to exploring the science behind what it means to live the Longevity Protocol, we'll dive into a wide range of topics. So, get ready for an exhilarating journey in what it means to live well and feel your very best at any age. Have you ever heard of a coregasm?
No.
You've not heard this? We've not talked about a coregasm?
Well, I've heard of it through our studies, but not anywhere else. Ever. I've never seen that on
Yeah. No, you
social.
haven't seen that on social media. I'm sure now that we've talked about it.
Now it's going to be everywhere.
It's all listening to us.
Coregasm. Do you coregasm?
And here's how you do it. You tend to see it more in women. Women will experience this orgasm in the midst of exercise. It can happen in any type of exercise, but particularly that's why they call it a coregasm, when you're working on your core. So women that are just simply doing sit-ups, and it seems to be sort of a repetitive kind of thing. You need to get to a certain number of repetitions in order to achieve it. For sit-ups, it's right around high reps, so 100 to 200. So I'm giving the number right now, so hit the number.
So what I would challenge everyone out there, all the women out there, do 100 sit-ups a day for the next 3 months. It's going to get your abdomen worked out in time for bikini season and will hopefully translate to a new type of sexual experience.
The coregasm.
The coregasm, right?
Yeah. I mean, that's, again, this is basic research on all of this, observational. So heavy weightlifting can do it. Biking can do it. Obviously, the biking makes a level of sense. You're getting a direct stimulation to the vulva, the clitoris.
Correct.
All of these things can increase your chance of orgasm during exercise. So you might as well exercise. It's going to help sexually anyway, and you might get a nice bonus in the midst of the exercise. So go for it. People often ask about what's the best diet for libido. What's and libido means, again, I want to. So what are some of those things? And it really comes down to really just kind of a handful of things, really 4 key things. One is zinc. I think it's probably the most important mineral when it comes to not just arousal, but for hormones and androgens, testosterone.
Yes.
Essential fatty acids. So this is like your fatty fish and those things. Antioxidants and flavonoids. Pomegranates are very well known to increase circulation. If you're increasing circulation, again, we're back to this idea.
Pomegranates are great for females. They're, you know how they say that food in nature will often indicate what it's good for. So the cross section of a pomegranate is often referenced as a visual for the ovaries, with all the follicles in it and everything.
Yes.
I mean, pomegranates are so good for the woman. And they're an aphrodisiac. And they symbolize this idea of fruit that's hard to get, but so satisfying when you get it, so.
Yeah, it is hard to kind of open those things. It's kind of challenging. But.
Yeah, and then you get these little aprils in the middle. Yeah, I like pomegranates. That's great.
And then finally, on top of all of that would be protein. And I think the protein. Animal protein.
Yes.
Thank you. And I think it's important to emphasize that and maybe come back a little bit back to the exercise as the exercise relates to muscle. And we've been emphasizing that for years. I think in the past maybe 7 or 8 years, we started really focusing on or stressing the importance of muscle for particularly women. Guys, they can get their brains around that. It's something they often, even guys that are relatively sedentary, often have a decent amount of muscle. But muscle is so incredibly important for women, and in terms of their overall health, which all of this would in turn be for your best possible sexual optimization, to making sure you're having muscle, and that takes protein. So again, zinc, essential fatty acids, antioxidants, flavonoids, and protein. So it's kind of like that fruit and animal protein thing gets you all these things we're talking about. Fatty fish, oysters. We love our raw oysters. I just absolutely love raw oysters, and one of the best aphrodisiac foods out there. And
so
again,
delicious,
super high in zinc.
Yeah.
Now, there's many different herbs. So people ask about that. What are some of the herbs that I should consider? There's a lot. And we don't have to get in all of them, but I think the two to probably focus on here, I like maca. Is there another one that you would like for women? Do you think maca is a pretty good one for women?
Specific to what we're talking about, maca is always the one that comes on top.
Mm-hmm.
Then when I'm talking about herbs, like you said, there's so many of them. Then that's where you start looking at the personality of what the sexual dissatisfaction is about. And then that's going to help you match herbs that are going to be better. But when we're talking about just like foundational, then maca's your king or your queen.
I think so. And I think it's very nutritional as well. A lot of these herbs are that. And I think maca is right at the top of the list that already having a lot of those nutrients we were just mentioning. It's already within that herb. And these things are easily found. So hormone optimization for women. Let's talk a little bit about that. Let's spend some time on this one. So, of course, we want to look at a comprehensive approach. And this is how we always do hormone replacement therapy. We're making sure that we're looking at many different angles. When we say hormones, we don't just mean sex hormones. We're talking about thyroid. We're talking about adrenal. What are your thoughts about all of that?
My thoughts are that when we're talking about sexual satisfaction, sometimes I like to bring the conversation with the patient to remind them to think of humans as just like, from an evolutionary perspective, like think of a human just as like what is the animal instinct of the human being, right? Sex for pleasure and sex for reproduction can only happen in a safe, optimal environment. The human body is not going to prioritize libido when it's in danger. Okay. So most of these herbs, most of these supplements, most of these dietary recommendations and the hormones are all going to be about what makes you the healthiest that you can be so that your body from an energetic perspective doesn't feel like it's in danger. It doesn't feel like it's running away from anything. So when we're talking about a comprehensive approach, like it's a must. If you're getting assistance in sexual wellness and they're going straight to just what's your vaginal lubrication, then they've already missed the boat in my mind. They've got to first say, okay, what's this person's baseline state of health?
Yeah. And, hormones, since you said that about, let's say, lubrication, we will look at estradiol levels for women. And if those are low, and testosterone and DHEA, if those are low, that could be why they're having lubrication.
Exactly.
And then
that's
you correct
the thing.
that. And then now you don't have to necessarily give anything topically to the vaginal tissue.
That's
You're just treating the hormones and all of a sudden everything is better.
That's why that's so important. If you're starting with a comprehensive approach, then you're going to potentially knock out right away some of the symptoms that are causing the sexual dissatisfaction to begin with.
So everyone listening right now, definitely for women, and that's what we're talking hormone optimization for women, make sure they're checking your estradiol levels and that they're treating that, looking at testosterone levels for sure, making sure they're understanding how to judge optimal levels on testosterone. You can't just look at what's on the lab itself. DHEA, incredibly important. All these things help with not just libido, means I want to, but it's helping with vaginal sensitivity. It's helping with sexual response.
And then from there, just like with the herbs, that's when the nuances of that particular person's case becomes important. Like, is this an adrenal picture that needs to be looked at? Is this a thyroid picture that needs to be looked at? Is there something else? Are they having IBS and there's pain with intercourse? Okay, then we got to look at the gut. So that's why you start with the basics. What are the elephants in the room? And then through good open conversation and being a good, investigator, you'll be able to identify what else do we need to check out.
If we're going to give hormones to women, there's two key ways that we tend to do it. Either we're doing subcutaneous pellets or we are doing hormone injections. And those are the two things that we have now 18 years of doing this. These are the two ways that I think are the best for patients.
That's right.
And there are other forms. There's creams, there's gels, there's patches, there's oral lozenges and pills, all of which can potentially be somewhat effective. But generally speaking, we have seen more of it to be not effective, which is why they often come to seek out a different way to approach it. It's easier to give creams and all of this. It's simpler to do clinically. You have to have a little, if not a lot more finesse and skill.
That's right.
With certainly the pellets and even the injections, the way we do that. We've sort of created a specialized way that we give the injections.
Wait, I'm sorry. I just wanted to say about the injections and the pellets that what we have found after almost 20 years of doing this is that they are going to provide the most systemic, comprehensive benefit for all of the aspects that may be contributing to the sexual dissatisfaction. That's why we find them to be so important.
Yes. And you're saying systemic, you mean body-wide. It's going to get inside the body, and it's an inside-out situation.
Yeah.
And it's as I always say too, it's like a shotgun approach to many, many things.
Yeah.
I mean, if you don't feel, you don't have energy, you don't want to do anything, let alone sex. So it just can help to increase metabolic rate. If you have vaginal pain, because you have a dryness, and that's being addressed from an inside out situation. Now suddenly libido goes up because now I'm not in pain.
Yeah. Like I've never had a patient come in and say, I feel amazing. My energy is great. My exercise is amazing. My libido is through the roof. I have awesome orgasms. Everything is so good. But I have so much vaginal dryness that I have cracking in my labia.
Right, yeah.
No,
that doesn't
happen.
Right.
That does not happen. So why are you having the cracking and the dryness in the labia? Therefore, vaginal cream is not going to be the answer that is going to truly address why you have the pain in the labia in the first place.
Sure. So I really want to stay focused here and on the actual treatment so we understand what all these things are. So when it comes to the pellets, these are small little hormone pellets. It is natural and bioidentical estrogen or testosterone. It's made usually from Mexican yam. It's a typical, sometimes soy, but usually Mexican yam. And it is made into the exact shape of estradiol or testosterone. And so it's what we call bioidentical.
You mean chemical shape?
Chemical shape, the molecular shape.
Yeah.
And then that's put into the shape of a pellet. And then that pellet can be very simply surgically placed underneath the skin. It's a very minor surgery procedure. And we numb a little area on the side of the hip, make a small little incision the patient doesn't feel, and then we use an instrument to just very easily place the pellets underneath the skin.
Yes.
And they'll last between 3 to 6 months. Fantastic.
3 to 4 mostly.
Most women, if I had to pick a number for women, it is 4 months, even though they sometimes have to come in at 3, and every once in a while they can last till 6. But yeah, 4 is probably the most common time frame for women. Men will last between 4 to 6 months, with the most common time frame being about 5 or so. So really, really just a profound way
so
to do it. And we've been doing this for so many years. When you really know how to wield that tool, it's effective. When you don't know what you're doing, and I see a lot of monkey business. Up. Yeah, I just had a patient the other day that came on Friday, and he's from Wyoming. And this doctor, she was putting pellets in him, huge doses. His levels were through the roof. He had side effects that were making his blood thicken, which can happen. I mean, our patients will sometimes have this, but we're addressing it. She wasn't paying attention well enough to it, was saying labs were done incredibly infrequently. But not only was it a risk because this guy had a cardiac history, so his thickening of the blood was that much more important. But the flippant sort of thing that she said, was that it doesn't matter how many pellets I put, it's all sort of irrelevant how often you come. He was coming every 3 months. And by the way, guys virtually never need to come every 3 months. It's almost criminal to have a guy come in 3 months because his levels are just going to go through the roof. It's going to be super physiologic. So we do see the monkey business out there on how, we first started doing this. No one was doing it with pellets. Now I say it's like 7-Eleven. There's one in every corner.
Yeah.
And for the good and the bad of it, it's good that more people are doing it. There's more patients that have the options for pellets, but it also creates it's
definitely an art. I mean, you can't be cavalier with dosing hormones, especially in a pellet, because you can't take it out.
Yeah.
So you really want to know what you're doing. And I always prefer a patient to say, I'm not sure I really felt anything. And to say, okay, then we'll go up, than to go in there like gangbusters and then, you overshot.
Yeah. Managing expectations, truly treating and working with the patient, creating a relationship.
Mm-hmm.
So the other version for hormone replacement therapy for women is hormone injections. And, historically, what we both would have thought of injections were that an injection would be an intramuscular injection for a woman, and her estrogen or testosterone would go through the roof after the injection and then come down, crashing. And I think classically the way it had been given, it was that.
Right.
Because it was an intramuscular injection with a larger amount. So what we figured out now several years ago was how to actually put incredibly small amounts of estrogen and testosterone into a very, very small syringe and then give that injection subcutaneously into the abdominal fat. Yeah. And we see fantastic levels. We don't see big spikes up. We don't see big drops down. And women only have to inject one time
a week. Very easy. And they self-administer. So you don't have to come into the doctor's office to do it. And of course we show everybody how to do that. Yeah, it's a great therapy. I mean, it's so darn easy. Yeah.
So for us, we offer those two options, and that's usually for most women. They'll be good with one or the other. People will ask me, well, which one, what I think is the best one to do. And it really does depend on the patient.
It depends on the individual.
If you're making me choose, I would choose pellets for most women. And a lot of that has to do with this. I just have so much experience with giving them for patients that I know how to wield that tool, and we just get great responses with it. So it's pretty straightforward. But the injections, now that we have figured that out over these past several years, it is a
very,
really,
very
really
satisfying.
Good,
yeah.
Okay, so that's women. That's hormone optimization. That's how we would do it. I would add here about DHEA for women. We check those levels. We want to make sure that's optimized. DHEA is an adrenal hormone, and we will give that in a couple different ways. We can do that orally, and that works relatively well for women and men orally, but we also can give that into an injection as well. And the other thing, and I would say just for women particularly, I know we're not to that point. We're just talking about hormone optimization. But DHEA, vaginal DHEA, is really, really good. So if we have that immediate issue, had a patient come in, a couple of weeks ago now, and she said that sex was like knives. It was just so specific of a description. And I always write those things down, keep them in the chart, and then I come back and I say these things to see, are you still saying, is it like knives? And by the time I saw her, she started about 6 weeks ago. She got her labs at 4 weeks and came back and see me at 6 weeks. And I had given her estrogen and testosterone injections. So we didn't even do the pellets, we did injections. And I gave her DHEA vaginal cream. And within a month, it was gone. It was just gone. And then I also scheduled an O shot, and one of our other fantastic doctors, Dr. Mason, did the O shot for her. But she told me that the pain, the knives thing was
had
gone.
Gotten better before.
Yeah. So that was just like a little bit of internal estrogen and a little bit of extra DHEA cream. And we did some other nutritional things. I don't remember exactly what, but some of the usual things that we would do nutritionally, magnesium, zinc, other things. And that was it. A month. Went from just an issue that she had for really years and to the extreme of saying knives, gone in a month.
The thing is, the body's really smart. So if you can do a good job listening to what it's saying and assessing the symptoms and interpreting them, then you can go through these lists that we're providing and delicately replace the things and see what happens. They're so non-invasive. They're really just non-invasive techniques. It's basically you're just repleting the soil.
Yep. And let the body go.
Let the body do. And if it's not enough, you keep looking.
There are peptides for women, something called bremelanotide. Bremelanotide is PT141. This is actually one of the few FDA-approved medications for female sexual dysfunction.
Right.
And it's an injection twice weekly. Again, small, little, tiny little needle twice weekly. And bremelanotide is a peptide that's stimulating the central nervous system to send a signal down from the brain all the way down through the spinal cord, to the areas of the vulva, et cetera, to help with orgasm and just excitability, stimulation, et cetera.
Yeah.
Okay. Thyroid optimization.
Obviously.
I mean, yeah. This is for both men and women. I'd say particularly with women because you see more thyroid issues in women. Libido, psychological desire and drive to have sex is affected by low thyroid, and it is very, very common in women.
Anxiety and depression is affected by low thyroid, also very common in women. And it's difficult to have a healthy libido when you're feeling depressed or you're just totally angst out.
Yes. And again, just back to good old fashioned energy,
That's right.
Thyroid's the
Or
sovereign
feeling
of that.
pretty, like, when your thyroid is underactive, you might be more prone to being overweight, to having more acne, to having more hair loss.
Yes.
Just not feeling, your cutest self.
Sure.
Cutie.
Cute. You're cutie. There's something called Sika, which is a fancy word, just means dryness. So in low thyroid, patients can experience Sika, so dryness of the eyes, the skin, and the vagina.
Yeah.
So if vaginal dryness, yes, we tend to think of sex hormones like estrogen, certainly testosterone, DHEA, but also thyroid. So that you'd want to make sure that is optimized as well. Then we come down to actually improving the vaginal tissue itself. So we just largely laid down, let me just say this real quick too, because I think I put it somewhere else. I might as well say it now. People ask, what should I use for a lubricant? And we have been talking about coconut oil for years. I think it's one of the best things that both men and women can use, because guys will sometimes, the glands of the penis can get dry. But certainly, let's just say vaginal dryness for women, or just a lubricant for sex. It is incredibly natural. It has positive effects for the flora or the good bacteria within the vaginal vault. So coconut oil, it's easy.
Yeah, we also carry through Agent Nature an oil, an intimacy oil that I think is really nice. It's super clean.
But it's from Agent Nature.
Yeah. I'm not good with those kinds of things. I remember a label. I remember logos. Like. Right. I know that I looked it up, researched it well, made sure I liked it. But it's just got a nice texture. It doesn't really crumble. Because a lot of times lubricants will crumble, and that's just kind of gross. It smells clean. It's just a really nice product, but that's it.
Okay, so
we can add
to the vaginal
to
tissue, the Agent Nature intimacy oil. So of course, if we're trying to just affect the vaginal tissue and potentially the appearance, again, no surprise, hormone replacement therapy, that has to be in place. It's gonna help. And also, I really want to stress that we want to do this right away. Women, as soon as they think they're having hormone issues, once you get into your mid to late 30s and on, and things are strange, things are just not what it used to be, go get assessed, consider that interaction and some kind of treatment. Because the sooner you do these things, the better. When we have patients who come to see us because they sat around suffering for years because they didn't know to look into these types of things, and now they have vaginal issues, it's more challenging to correct that. That doesn't mean you can't. It just means
prevention is always easier than correction.
Or early onset. Okay, just started, you're having some dryness, things are starting to change a little bit. Let's correct that now.
Okay.
And so you certainly can. So any kind of perimenopause, you should start to really consider these types of things. Women can go into issues where they're actually having atrophy. So if they have they go into menopause, perimenopause, then menopause, and they didn't get any kind of hormone replacement therapy, it gets to the point where the vaginal tissues just shrink.
Mm-hmm.
And that could have been addressed early on with hormone replacement therapy, both internally and sometimes externally, and just prevent it from ever happening. But once you get down to that point, it's harder to reverse that. So keep that in mind, prevention. The O shot. Oh, the O shot. I love the O shot.
It's so good.
It really just is.
I mean, I think it's so good for incontinence. And I think it's so good for people who are having physiologic disruption to orgasming. In fact, I'll say to a patient, if you're very happy with your clitoral sensitivity and you're getting an O shot for incontinence, perhaps don't inject the clitoris, because it's so effective.
Right. Yeah.
Yeah, it's so effective. I always liken it to like a priapism. I mean, it's like, having that delicate tissue exposed and hypersensitive. But if you're underwhelmed by your ability to orgasm, wow, what a great effect.
So what is the O shot? The orgasm shot. This is using platelet-rich plasma. We draw a patient's blood. We spin that blood down in a special way that separates out the red blood cells from the platelet-rich plasma portion that has growth factors in it, stem cells, other things, but mostly growth factors. And then we can strategically inject that into the anterior vaginal wall, which is the area just underneath where the urethra is, kind of that G-spot, typical G-spot area, we would say, just right into the introitus. And then also, like you were saying, definitely straight into the clitoris. Ladies, you are numbed up. The women are numbed up 3 times over by the time we even get to the clitoris.
Yeah.
It's actually the clitoris, interestingly, is the easiest thing to do. They never
don't feel anything,
never feel the clitoris. They feel maybe a little bit of pressure with the anterior vaginal wall just because we're putting about 4 cc's of fluid, but it's very easy. It's very simple. We set the whole thing up to where it's very relaxing when they come in. They get numbed. And it's a pleasant, simple procedure. It takes more time to numb them up and relax them before with the actual time of the procedure.
And it's pretty quick results. I think that one yields the benefit pretty quickly. And as far as how often does a person need to do it, it's very case by case.
Sure.
I mean, I've had women, they've done their one and they're done and they're good.
Yeah.
I've also had patients that are like, no, as long as I do one annually. I mean, it's so individualized. But it's so worth it. I think the incontinence alone is just, that's a disruption in quality of life.
Yeah. So incontinence, coughing, laughing, sneezing, jumping rope, etc. These things, and then urine's coming out. The O shot will help to strengthen that area. And it has about a 90% success rate for incontinence.
Yeah.
It's really, really good. So I highly recommend the O shot. Now, interestingly, we're talking about appearance and those kind of things. So with this platelet-rich plasma, and even something called PRF, or platelet-rich fibrin, it's taking your blood and just spinning it slightly differently, creates a little bit more of a gel. And that can actually be injected into the labia majora. So this is not the small lips. This is the majora on the sides. And for some women, they will get some atrophy as they get older. And for some women, that may or may not be a cosmetic concern. So you can actually also numb that area very easily and inject this natural filler into that area and kind of plump it up. So again, this is all cosmetic, but this all helps with confidence and other things that we've talked about.
And pleasure. I mean, if you're pleased with your appearance, and you're going to have an easier time feeling pleasure.
Sure, it heightens all of that. One other thing too, there's something called the Pink Intimate System, and we have this available. This is a system that was created out of Italy. It's a 100% natural, mild, skin lightening type of topical cream. And it's done in office, very, very simple to do. And this will help with, again, pigmentation that's been laid down. Again, if it is a concern, you can put it in the armpits. Yeah. Some women want their areolas lightened a little bit. Yeah. It gets a little bit darker.
There's a lot of hormonal changes with pregnancy and menopause that can cause discoloration to these intimate areas. And it's such an easy and such a benign procedure that, again, can just make you feel that much more comfortable. I think it's great.
Sure. We can add that on to the O shot. So the classic O shot, if somebody wanted the wing lift, that could be done. Mm-hmm. And then you sort of finish up also with the Pink Intimate System, if that's something that somebody wanted. So all of these things,
very comprehensive.
Treating the whole area. I think that DHEA vaginal cream, I want to continue to emphasize that. I've just found that to be so beneficial for so many patients over the years. To don't underestimate using that one. And very often with the DHEA vaginal cream, they don't have to continue with it. Any kind of topical vaginal approach that we tend to do, we're getting the patient out of immediate discomfort, working from the inside out. Right. And very often they don't have to continue to do that. We keep with the DHEA, maybe they'd stay with a very simple pill or maybe an injection, depending on their situation. But again, it works really, really well. Sometimes for the vaginal tissue, we actually have to treat the gut. Mm-hmm. Here's one of your favorite things. And if we treat the gut, we treat candida. Yeah. So if candida systemic inside the entire body as well as the vaginal area, if candida is there, you're going to continue to have problems.
Yeah. Again, with changes in hormones like perimenopause, you, one, can get pH disturbances. It allows for yeast overgrowth. This is going to be compounding any problems related to atrophy. So you're thinking about literal pain, itching, discomfort, noxious smells, things that are just going to make sex very dissatisfying.
Mm-hmm. So that's largely how we would be able to approach that.
And you didn't mention for the O shot and for the P shot, they can upgrade, because the plasma that we're using for the O and the P shot are dependent on the patient's, really their state of wellness, right? So the healthier you are, the more rich and useful and restorative your plasma is going to be when we spin it down. But those patients that are a little bit more depleted, perhaps not yet in a state of optimization, we can always supplement with upgrades.
Yes. So what's that upgrade? Stem cells. So stem cell therapy, which this has all been around for a long time. We typically use a product called Wharton's Jelly. And Wharton's Jelly, this is the sort of spongy stuff that's found inside the umbilical cord. Women, these are live births. It's a cesarean section. They donate. So it's not a selling thing. They just donate their placenta, right, the whole thing. They've been screened out to like about 30 different diseases, and then it's donated. It's given to the manufacturer, and these are all U.S. based. And then they then further screen. Actually, they screen the placenta and et cetera for 2 more times, because they quarantine it. They screen it, then they quarantine it, and then they check it again. And so it's very, very pure. And then they're getting all the stem cells and other supportive scaffolding proteins out of that Wharton's Jelly, the spongy kind of stuff.
Right. And
that is FDA indicated for treating what's called a structural defect. And the structural defect here would be the vagina, right, the clitoris and the penis, that we're trying to get more nerve flow, more blood vessel growth. So yes, that when a patient gets to a certain age where we really start to really encourage the Wharton's Jelly upgrade, the stem cell therapy upgrade, is once they get around 65, 70 and above, we're really encouraging that, because the quality of their own blood for their platelet-rich plasma is just going to go down. It's for all of us.
Right.
So, but if somebody would just say, hey, I want to maximize the best possible result, regardless of age, we always encourage that upgrade. So we really pretty much went through everything.
That was
there.
beefy.
Yeah. It's an interesting word you're using, but yes, that was complete.
So meaty.
What was that from? That was
Talk Soup.
Talk Soup from SNL.
No, I don't remember. Whatever, MTV. I don't know.
Anyway,
it was funny.
That was a very complete episode of all the treatments that for ED and female sexual dysfunction, cosmetic things and otherwise. Right. How do you optimize? There it all is, guys and gals.
So many options that we provide, so much opportunity for discussion. And ultimately, the answer here is don't settle. Like we always say, don't settle. The days go by so fast. Live every day fully and deliciously, knowing that you're super happy with the way you look, feel, and the same is true for your partner, so that you're having wonderful sex and maintaining that anchor to longevity.
Are you liking what you're hearing? Do you want to hear more?
Are you loving this great content, and do you want to ask us a question?
Please like, subscribe, and comment.
You can find all of our links on our social media, featured articles, basically everything we cover at Linktree at Longevity Protocol Pod.
And if you want to understand and hear a little bit more about our personal lives, follow us on Instagram at The Sex Docs.
Here's where you can comment and ask questions that we will directly answer in our videos.
Be sure to subscribe to our Substack. This is where we get far more information for you, protocols on longevity and health, and definitely the notes for today's episode.
And finally, if you're ready to make a change, a real change in your own life, feel free to check us out at our private practice at hormone-zone.com.